other people, but you would call me under my most favored nation spot, which I think is the most important thing, Bobby, of all what we've done, because we're bringing drug prices down by 80, 90%, depending on the way. You could say 5, 6, 7, 800%. Depends on the way you want to calculate it, right? But let's go the old-fashioned way. But drug prices for prescription drugs will be down 80, 90%, 75%, 68%. They've only gone up. For years and years and years, they've only gone up, and now we're going to have essentially the most favored nation. We're going to have the most favored price in the whole world. Whatever the lowest price in the world is, that's what we're going to pay. And I don't want to go into a big deal, but nobody else could have gotten this but this administration. I'm being very nice when I say that. The cost of prescription drugs is coming down by a number that was never even thought of. This will have a huge impact on healthcare, by the way, because obviously drugs are a big part of healthcare, and it will help repair some of the Unaffordable Care Act's damage that they've done, because the Unaffordable Care Act, which is Obamacare, it's unaffordable. It's not affordable, and it's a disaster. And hopefully we will be paying money directly to the people instead of giving the insurance companies the money. They'll go into a healthcare savings account or whatever it is. But think of it. We pay the money, billions and billions, really trillions of dollars going to insurance companies. We want that money to go to the people. They buy their own healthcare. And it's so popular. The problem we have is the Democrats are owned by the insurance companies. They're literally owned lock, stock, and barrel by the insurance companies. And they hate it. But the people love it, including all Democrats. So I think we'll perhaps be successful with it. But it was an idea I had. You know, I read the papers, and I'm reading one of the stories about the insurance companies, how much money they're making, where they received, billions and billions of dollars for this stuff from the United States of America, and their stock has gone up by 1,400%. Think of it, 1,400. One went up 1,700%. Numbers went up. If you go up 1,000%, you're doing bad in that business, right? And it's all because of the money. Not all, but mostly because of the money the United States pays the insurance companies. They say, this is big stuff. And I asked somebody, why don't we just pay the people directly? And they said, that's a good idea. It's funny, it's a very complicated business, but actually it's not so complicated. And I went to Bobby and I went to Dr. Oz. I said, can I talk to you guys about this? Is this the kind of money the insurance companies get? Yes. Why don't we pay the people directly? And the primary answer was that the Democrats will never go along with it. But the people go along with it, because I put it out. It went viral. It went viral. Susie, I went all over the place. It became the biggest story. I just said it. And so I think we have a great situation if we can do it. But if you think most favored nation policy for drugs will bring your drug prices down at levels. So now if they're selling a pill for $10 in London and $130 in New York, the London price will go up to $20 and we'll go down to $20. So we'll go from 130 down to 20. And by the way, tariffs did it again, because the drug company said, we'll do it begrudgingly, but they were okay. But we'll do it, but no nation's going to approve it, because even if you raise the price by, like on a pill, $10 to $20, you're doubling the price of their prescription drugs. I said, no, they'll do it. And when I got them on the phone, I said, if you don't do it, we're going to charge you very substantial tariffs, more money than that's going to cost you. And they said,